Good afternoon, this is Dr. Barbara Toppin. Once again, I am fielding questions from the OB population, or soon to be OB population. One of the questions that I was just given was a question on how to deal with anxiety during the pregnancy amid the COVID outbreak. That is a big and hard question because we do have to make a balance between exposing our patient to the settings in the office where other patients are filing through who may or may not be ill, and also helping to alleviate their fears. Our general rule for patients who have experienced stillbirth or for miscarriages or anyone who might just have anxiety regarding their pregnancy is that if they are worried, they can call us at any time. We have in our office 5 RNs who triage for us, and we're happy to bring a patient in to hear the heartbeat, just for the heartbeat, outside of the visits. We do realize that we are doing telehealth for many of the visits, and we ask the patients if that is okay with them. If they want to be seen, they may come in. If they really just want to hear the baby's heartbeat, they may come in. So we're absolutely happy to bring the patient back in because we do know that anxiety exists, and we don't want the patient to have the anxiety of pregnancy loss and the anxiety that comes from the COVID infection to hang over their head. I guess my best suggestion for patients who are feeling anxious during their pregnancy would be, if they're at home, to develop a hobby. We have patients who are making masks for our office, which is a fantastic thing to do. We have patients who are taking up art and lots of other things to help them with their anxiety. We also provide them with a line from goodtherapy.org that has available psychotherapists if they feel that their anxiety is getting out of control. Again, for our office, we have 5 RNs who help with the patient's anxiety. And again, we do bring patients in if need be, but general exercise, hobbies, things like that can help to alleviate some of the anxiety that you feel day to day and where you have nothing much else to do except sit in your home. But I encourage you, if you're not one of our patients, to call us if there is a problem, if there's a concern. Our patients know that already, and our nurses usually are able to help patients with whatever anxiety they have. There are many times the doctor will call. I did that for a patient last week who was just anxious about her delivery, and she's nowhere near due, but she wanted some answers, and we were able to provide her with delivery answers. And when I spoke to her today, she said that she felt much better and she was feeling less anxious. So I encourage you to reach out to your provider. And if you feel the need to go in, no one is ever going to reject you in their office. We may have fewer visits, we may have tele visits, but if you feel that you need to come in, we will see you.